The purpose of an upper body lift or bra line lift is to remove the extra skin of the back. So when I say back, I mean the upper back in this case. And if you have lots of rolls of skin underneath your arms that pile up on your upper back, the best treatment is probably an upper body lift or back lift or bra lift. They're all essentially the same thing. And what it involves is cutting out that extra skin and putting a scar along the bra line of the back. Now, you may say, why can't you pull that skin down similar to a tummy tuck? And unfortunately, on our backs, to get rid of that skin, we actually need to pull it up. The upper back rolls can only be removed through an upper body lift or an upper back lift, which involves pulling that skin up and cutting it out. So on the back side, all of our excisions pull skin up, and that's just the way that our tissues are designed and how they're all attached to our body. Whereas on the front side of our bodies, when we do a tummy tuck, we pull the skin down. So it can get kind of confusing because people always ask, why can't you just pull out my back rolls by pulling down? It just doesn't work that way based on how all the skin and the fat is connected to everything else. So to fix the upper back rolls, we need to do an upper body lift, and that involves cutting out that extra skin and putting a scar along the bra line. Now, oftentimes, and most of the time, people need liposuction of this area as well. And most of the time I'm doing this, it's usually part of a tummy tuck. So most of the patients that I see who have these back rolls are getting 360 liposuction and a tummy tuck. And I tell them that I'm gonna suck out as much fat from their back, their flanks, and their abdomen as I safely can, and then I'm going to perform a tummy tuck. However, in sucking out all that fat from their back, they may have loose skin back there, which we may have to treat in the future with a bra line or upper body lift. Now, I can't do a bra line or upper body lift at the same time as a tummy tuck because they would be fighting each other. On the back side, the bra line lift or back lift is pulling up, and on the front side, the tummy tuck is pulling down. So not only do they have opposite vectors, they also disrupt each other's blood flow with regard to healing. So those two operations need to be staged, but it works out because there's a good chance after liposuction of the back and sucking out the fat from those rolls that the skin might tighten up on its own. In which case, then you don't need the back lift or the bra lift, and you don't need that ugly scar. So it works out that we would perform liposuction first, along with the tummy tuck and all the other procedures, and see if over time that skin tightens up, so that way you might not need the bra line lift or back lift. But if you do, if that skin doesn't tighten up and it bothers you and you want it cut out, we can always do that later. Once your skin has healed and your tummy tuck has healed, we can safely go back and remove that extra skin. We could do it as early as a month and a half after the tummy tuck. So about 6 weeks after the tummy tuck, you could have a bra line lift or back lift. However, I would recommend waiting at least 3 to 6 months to give that skin a chance to tighten up on its own, and you may not need a back lift. So I hope that makes sense. I hope that explains what an upper body lift or back lift is. If you have any questions, please let us know. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.